So we continue our regional look into some of the big stories that made headlines, and we go now to the Free State. And from the beginning, the country's epicenter in the genesis of the coronavirus cases, the Free State continues to soldier on to prepare for possible increase of infections. The recovery rate is standing at 61% as of Saturday, but now the move to level 2 can lead to a surge of infections, and that's the fear. It has not been easy for the Free State. Take a look.
Bloemfontein became the province epicenter following a church conference in March at the Divine Restoration Ministry in Bloemfontein. 5 international guests were found positive and many religious leaders followed. The gathering left the province scrambling to control.
We have therefore activated a whole program of contact tracing to find the members of the church so that they will be evaluated in terms of their risk profile, and then some of whom would have to be tested immediately and others would probably have to be watched depending on the assessment of the tracing team.
The Department of Health had to buckle up for any eventuality. Extra beds made available for coronavirus patients and special wards had to be prepared at healthcare facilities. Meanwhile, many healthcare workers at the forefront of fighting the coronavirus downed tools.
At least fumigate the place and we'll come back to work, because you must remember the COVID is not only on the surfaces, it's also on the curtains. So if they talk about the deep cleaning, how effective is the deep cleaning? That is the question that we've been asking and we didn't get the answers. The other thing is, in labor ward, we don't have isolation specifically for patients who are positive. So you have to nurse the COVID positive patient in one of the delivery rooms. After you are done there, you go back to the normal patients and go on with your work as normal.
We are going out to the funerals, we are going to parties when we are home. Moreover, we are not even having that time because we work hard at Gynae Clinic and the whole unit, even the hospital as a whole. There's nobody who has time for parties and everything.
So surprised, they say today I got COVID from the community. So I want to understand which community, because here at work I'm working with a COVID suspect patient.
On the bright side, the pandemic afforded the homeless shelters. The experience has been different for many.
About coronavirus, I heard that it affects people by breathing, and it could be, but I do not know what shall it be that could stop it, or the cure shall be,
When we are home, we have to spend double of what we have been spending because we are all day home. So it has affected us a lot.
News coverage also affected.
Many of our journalists have not been at work. Some have been ill as a result of that COVID-19 pandemic.
The province is not immune to the alleged COVID-19 contracts scandal. Political influence claimed to have been the deciding factor behind the appointment of tenders for COVID-19 services.
We need to appoint a service provider that is going to review the work that was performed by the supply chain management practitioners to make sure that all the processes are properly followed. Already, the internal audit of the department has started with that work, but we still want an independent opinion.
From the harsh level 5 regulations, this is where we are at the current alert level 2. Makhala Masiteng, SABC News, Bloemfontein.
Well, the family of John Hlangeni, the first person to succumb to COVID-19 in the Free State, says losing a loved one and arranging their funeral under lockdown regulations made it difficult for them to mourn. Our reporter Aphumelele Mdlalane filed this report.
85-year-old John Hlangeni was a respected pastor from the Global Reconciliation Church in Bloemfontein. His family described him as a humble person who loved the Word of God. Pastor Hlangeni's 60-year-old son, John Hlangeni, recounts what the family went through after his death.
Kadi 26 za March, we had a short breath. And then
on the 26th of March, he experienced a short breath and we called an ambulance. This happened after he was diagnosed with gallstones. So he thought that was real problem. So we called an ambulance which took him to the hospital, and later he was returned home, and the following day they came to fetch him for testing and later returned home. On Saturday he got admitted and his results were back that he's positive. On a Monday the whole family went to test, and on Tuesday we went to the hospital. We were told that he will remain at the hospital mortuary and that he will only be coming home on the day of the burial. We made arrangements and we kept a register of all the people who were coming to the house before the funeral and during the funeral. And then the other thing, we informed them that only 50 people will be allowed. It was only the close relative that attended the funeral.
A register. We kept a register of all the people who were coming.
Wife of the late Pastor Hlangeni, 81-year-old Paulina Hlangeni, is a COVID-19 survivor. When I left my home, I was not feeling well, but nothing was serious. I even thought I would come back the same day. When I got to the hospital, I was admitted. The same day, doctors came to draw my blood, and after that, I really don't know what happened. I used to vomit a lot, and I was alone in the room. But I want to let the world know that coronavirus exists and it kills. I'm Aphumelele Mdlalane, SABC News, Bloemfontein.